Hello, today we will be discussing the first section of Chapter 16 and the treatment of psychological disorders. And so to begin with, we want to talk about why do people not seek treatment? We know of all of the major implications and the major issues that disorders bring up in individuals' lives, yet we still see a large proportion of people not actually seeking out treatment. And so we want to understand, why do people not actually seek out treatment if we know we have these effective treatments? So it's estimated that only about 30% of people actually receive appropriate treatment for their psychological problems. And your book suggests that there may be a few reasons for this. So there's a huge number of social costs in terms of productivity and impaired family life, relationships, and financial costs that are related to seeking treatment. So anxiety disorder alone costs the U.S. about $42.3 billion per year. Without schizophrenia, mood disorders, substance abuse, or other psychological problems. So people may not realize also that their disorder needs to be treated. Mental illness is often not taken seriously as a physical illness, maybe because the cause is so hidden. It can't be diagnosed by blood tests or an x-ray. So stigma also leads people to believe that mental illness is an issue of mind over matter. So personal weakness, not trying hard enough, or not just snapping out of it. And so this may be also related to why people may not seek treatment. This also is related to beliefs or circumstances that such as barriers that keep people from getting help. And so they may believe they can handle it themselves. Family members may discourage them to avoid embarrassing the family. Financial obstacles may get in the way. They may not have insurance. Culture and gender factors. Surveys have found that more men tend to have negative attitudes towards seeking psychological help as opposed to women. And so, in addition to that, not only are these individual factors going on, but people may not know where to actually look for services. And so not knowing who to go. Who do I see? A psychologist, a counselor? What are those two? What's the difference between the two? Do I go to a life coach even? So not even individuals may not be receiving the most effective treatment for their disorder. For example, cognitive behavioral therapies have consistently yielded better outcomes for anxiety treatment than any other therapy. Studies, though, find that 2/3 of people seeking treatment for anxiety disorders receive some other kind of treatment that is not CBT or cognitive behavioral therapy. So when we look at the real world and types of psychotherapists, there are different professions that seek to treat psychological disorders. And so the first one that we see are psychologists, that individuals receive a PhD or a PsyD. They typically go to school for around 5 years, 5 years of graduate school. They are specialized in assessment and psychotherapy for a wide variety of individuals and psychological disorders. We also have psychiatrists. So we often hear on movies and in TV shows individuals being psychiatrists. So psychiatrists are MDs. They've gone to medical school and they prescribe medication. They are not trained in how to actually conduct therapy, although TV shows and movies often get this twisted. So psychiatrists only can prescribe medication, and they go to medical school. So that'll be important to understand in terms of the distinction between psychologists versus psychiatrists. We also have social workers or master level clinicians, and they typically go to school for 2 years. They often are case managers for maybe DHS. They also specialize in poverty and family issues. We also see counselors, and counselors can either be at a master's level or doctoral level, and they treat people without the psychological disorders. And so I like to often talk about counselors or counseling psychologists more as individuals that treat people who experience everyday issues. So if you are experiencing testing anxiety, they can help you. If you are experiencing bereavement or grief over having lost someone to an illness, or maybe you have maybe gone out of a recent relationship and you're still having adjustment issues, counselors may be able to help those issues as opposed to going to any of the other choices that we have. And so when we look at approaches to treatment, we see that we have either psychotherapy, which is the traditional therapeutic route with psychologists or counselors, or we have the biological or medical route, which is frontline medication. And so when we talk about these approaches to treatment, treatments can be divided broadly into these two kinds. So psychotherapy is this interaction between a therapist and someone who is suffering from a psychological problem. And the goal of the psychotherapy is to provide support or relief from the problem. So providing support to the client, letting them know that what they're experiencing is normal, or that other people have experienced similar problems, and that we do have an effective treatment to meet their needs. And that's where we see the relief from the problem. We try to decrease the frequency of them experiencing panic attacks. We want to help them or elevate that depressed mood so they aren't experiencing that deep depressive mood for as long and maybe not as severe. And so your book talks more about the eclectic psychotherapy, and so they talk about this more as a type of treatment that draws from different forms of therapy depending on the client and the problem that they're presenting with. So I would treat a person with anxiety differently than I would treat an individual with depression. And so really the eclectic psychotherapy that your book is talking about is more of tailoring the treatment to the client and what they're bringing into therapy. So here we'll talk about psychological therapies, and with the first one that your chapter talks about is psychodynamic therapy. And so we've already briefly mentioned this in the first chapter and also whenever we talk about Freud. And so a number of psychodynamic therapies actually vary in a lot of different ways, but they all share the belief that the path to overcoming psychological problems is to develop insight into your unconscious memories, impulses, wishes, and conflicts that are assumed to underlie these problems or these difficulties. And so we see within psychodynamic therapy, we see a type of therapy known as psychoanalysis. And so this is where they focus on early childhood. And again, this is oftentimes seen in movies and TV shows. So traditional psychoanalysis takes place on average for 3 to 6 years with 4 to 5 sessions per week. That is a long time to be in therapy, for 3 to 6 years with 4 to 5 sessions per week. And this is where we see the client reclining on the couch, facing away from the therapist or the analyst, and is asked to express whatever thoughts and feelings come to mind. And so we'll actually talk more about some of these techniques that we see with the psychodynamic approach to therapy. And so the goal, again, is to understand these unconscious processes that Freud called developing insight. And the psychoanalyst can use key techniques to help the client develop insight. And these include hypnosis, free association. So we all know or have watched movies or TV shows where they use hypnosis. Well, free association is where the client talks about every thought that just enters their mind. And this process allows the stream of consciousness to flow unimpeded or unimpeded. And so they're just getting out whatever's in their mind, and the unconscious is supposed to come out somehow during this process. We also see dream analysis, which is where the client talks about dreams that they've had, and the psychoanalyst takes their dreams and talks to them about what it actually means. And so they treat dreams as metaphors that symbolize unconscious conflicts or wishes that contain clues for the therapist that they can help the client understand. We also see with any of these is a very heavy emphasis on the analyst to interpret whatever the client is saying. And so again, we see this heavy emphasis on subjectivity, and so the interpretation that the therapist is trying to decipher through these different techniques, they may or may not actually be representing what the client is feeling. So one problem that we see is that it can be overinterpreted, whatever the client says. So if you had this dream that you were in a dark place and you were 5 years old again, and you didn't understand what it meant, and you told your psychoanalysis therapist, they may say that you had a traumatic sexual experience with a visiting relative as a child. So what we see with this is that psychoanalysis really assumes that this is the basis of all your problems. Things that you don't even know happen to you are really the root of all these problems. And so analysis of resistance is another way or technique that they use, and this is if a client consistently shifts the topic of discussion away from a particular idea, then this is a sign that to the therapist that you don't want to confront the real issue. So even if you tell your therapist that no, that did not happen to me, the therapist may take that as an analysis of resistance, that you really don't want to face your issues. And so again, these are very real things that are coming against psychodynamic psychotherapy, and some real issues that we have with this type of therapy. And even though we do have these issues, there are still people that do exercise this type of psychotherapy. And so we may see an example of transference is if you develop an unusually strong attachment to your therapist. Freud worried that it would interfere with treatment, and this is an example of transference. If you fell in love with your therapist because they are the one that listens to all your problems and has all the answers, they would call this type of transference, and would sometimes see this as a barrier, but also may see this as a way of effectively treating someone. But again, this type of psychodynamic therapy has little evidence behind it and has some serious issues with the way that it is conducted. So here we talk about psychoanalysis that has gone above and beyond what we typically think or what we have just talked about with the psychodynamic approach. And so though Freud was certainly fundamental to psychoanalysis, modern psychodynamic theory reflects contributors, many of who followed him, including several of his students who actually broke away from his teachings. And these include Carl Jung and Alfred Adler. They agreed with Freud that his insight, or that the client's insight, was actually a key therapeutic goal, but disagreed that insight usually involves unconscious conflicts about sex and aggression. Alfred Adler believed that psychotherapy should help people overcome problems, and these resulted from inferior social status, sex roles, and discrimination. So prejudices, discrimination, and also gender stereotypes and stigmas. Melanie Klein believed that primitive fantasies of loss and persecution, worries about a parent dying or about being bullied, were some of the root causes of individuals' psychological problems. So all of these approaches stress that the individual's role in a larger society plays a role in the conflict that they experience. So these social themes are developed most explicitly in interpersonal psychotherapy, which is a form of psychotherapy that focuses on helping clients improve current relationships that they're in, whether that is romantic partner or family, or social relationships. And so we'll talk more about IPT, or interpersonal psychotherapy, later on in our discussion. But this form of psychoanalysis that doesn't follow that traditional psychoanalysis, but this form of it actually does have some research demonstrating its effectiveness in treating disorders such as major depressive disorder. So here we do talk about interpersonal psychotherapy, and so again, this is a modern approach to psychodynamic therapy. This focuses on helping clients to improve the relationships that they're in. It lasts from 12 to 16 weeks as opposed to the 3 to 6 years, and this differs from classic psychoanalysis in that the therapist and client sit face to face. They only meet once a week. So it's reflecting what we would typically think of therapy separated from psychoanalysis. The therapy lasts months rather than years, and the client experiencing relief from symptoms rather than insight is a goal of therapy. They are less likely to interpret client statements as a sign of unconscious and sexual aggressive drives or impulses. And so with that wraps up the first section of treatments for psychological disorders.